This video will show a step-by-step visual guide for locating and utilizing the EQRS Transplant Waitlist report. Typically, administrative assistants and facility administrators are the staff members with access to the EQRS system, which was previously called Crown Web. Please note, the information in the EQRS Transplant Waitlist report comes directly from the transplant centers and UNOS. This is not a network-created resource. This is a tool to monitor the status of patients who have already been placed on the transplant waitlist. This will not give you visibility to a patient's progress during the referral and evaluation periods. Once logged into the EQRS system, you will see this screen. Click on Dashboard in the blue ribbon at the top left of the page. Next, scroll all the way to the bottom of the screen and click on Transplant Center Waitlist. The waitlist will generate within the EQRS system screen. However, for ease of use and visibility, I recommend downloading the report and opening within Excel. To do this, click the download button on the middle right of the screen. Once opened in Excel, this is what the waitlist report will look like. You will notice that patients often remain on this report for extended periods of time, even after removal. For example, you can see that Donald Duck was removed from the list in 2015. I recommend quickly scanning the waitlist removal date column to ensure that no patients were removed from the waitlist since you last viewed the report. Once you have verified this, you can hold down Control-Shift on your keyboard and then select L. This will create arrows on each of the column headers. Click on the arrow for the waitlist status column, then unselect the removed option. Now you are only looking at patients who are either actively waitlisted or inactively waitlisted. Inactively waitlisted patients will not receive organ offers. So how can this information be used? One, you can scan the active-inactive column. Have any patients changed status since you last viewed the report? Perhaps you didn't know that Mickey Mouse has been inactive on the list since January of 2023 for the reason of candidate workup incomplete. This is the most common reason for inactivity. This is usually because a patient has not attended an annual check-in with the transplant center or because they have failed to complete some annual or additional medical testing that is required to remain active. Daisy Duck has been inactive since 2023 related to insurance issues. Both of these inactive reasons provide room for the dialysis team to provide follow-up and support. It is recommended that staff review the most recent 27-28 dialysis start date column. This will give staff an idea of accumulated wait time. While there is no way to be certain when a patient will receive an organ offer call, facility staff can begin to prepare patients practically and emotionally. For example, Goofy started on dialysis in February of 2022. He's coming up on 3 years of accumulated wait time. Having discussions with Goofy that can help him envision a life after dialysis will help to prevent him from shutting down or panicking once he receives an organ offer. You can find a list of conversation starters to approach practical and emotional readiness for transplant by going to the Network 5 website. Thank you for your time. If you have any questions about this report, please reach out to me, Elizabeth Neschke, on the Network 5 team.